Nurse Allen coming to you here from my vehicle. Today I'm just going to be talking about all things SENA. I've been bringing videos and just giving you little tidbits of advice when you are doing skills. Now, again, all skills are going to be state specific. Certain states have different guidelines, but in order to stay safe, you're going to follow your policy of your particular facility. So I just want to give a disclaimer that nothing I say is set in stone. It is just to give you some knowledge to take when you're going to your job. Now, when you're doing skills, you want to always make sure you're following best practice of your policies and procedures of that particular facility. Reason being, because if they got a citation, they may have to do things different based on their plan of correction. So when people tell me, oh, I've been a nurse and I've been doing this for 20 years, that's fine. You may have been doing it for 20 years. But if they got cited for something where you may go work at one facility, it's one way, and at another facility, it's another, maybe because they had a plan of correction and that was in their plan of correction. So you're doing it the way the particular facility has put in their plan of correction. So there's not going to be a one size fit all. And it goes back to even when you're doing transfers, it's going to be on your care plan. Is it a one person or a two person assist? Sometimes it may be 3 or more persons to transfer someone. I've been in all positions and I've seen people when I've saw them in a Hoyer lift or a sit to stand and you're looking like a scarecrow because you got the patient's arms up like that. That's not a safe transfer. The person, when they're using a sit to stand, should be able to hold on and assist. And again, based on their weight, because if their weight shift and that machine weighs anywhere from 500 to 600 pounds, and if their weight shift a certain way and it's not being manipulated properly, you could potentially drop that patient even on a sit to stand. So I'm going to be safe and protect my license at all times. I'm going to follow the policies and I'm going to make sure I'm safe. I'm sure you saw that young lady who's losing her job because she dropped someone in a Hoyer lift. Same thing can happen in a sit to stand. So always practice to be safe. Nothing is set in stone. I'm just here to give you tidbits to keep you safe and make sure that you pass all your skills. Thank you and have a nice day.